Good morning, everyone. I am Basil Alhashaikeh. I am a family medicine resident. First of all, thank you for giving us this opportunity to present. I would like to thank my group, Dr. Farah, Dr. Marah, Dr. Abdurrahman, Dr. Muhammad Juma, and Dr. Sham al who are helping us during this research. So our research is the prevalence, incidence, serological markers, and associated manifestation of SLE in Abu Dhabi, in both Abu Dhabi and Al Ain City. It's a cross-sectional study with multi-center. So going to the outline, we'll go through the introduction until reaching the conclusion, inshallah. So as we know, the SLE is a chronic autoimmune disease that affects multi-system, joints, skin's manifestations, serous membranes, and many multi-organs. And we know it includes from progression and regression periods with the treatment. So in worldwide, we have some characteristics or statistics about the prevalence and incidence of SLE. As we can see in the North America and South America, we have significant studies that shows what are the prevalence and incidence. However, in our region, especially in UAE, with the countries with the gray color, it means that no sufficient prevalence and incidence previous study that could estimate what are the really prevalence and incidence of the study. That's why we conclude our study to study what are the prevalence of SLE, and we contribute with them with the serological markers, I mean the autoantibodies that the lab test, and the SLE manifestation that we'll talk about further on. So this is one previous study that conducted in 2016. This is the only studies that include what are the prevalence and incidence of SLE in UAE. And it only shows that the prevalence and incidence that from the period of 2019 to 2012, and it was just showing that it's 3.5 per 100 population have SLE as population during prevalence during this period. However, what are special of our study, we add on in our study that we study what are the serological markers that those patients of SLE in UAE, that what serological markers, we study two serological markers out of all the autoantibodies, which is ANA and the anti-Smith antibody. And also we contribute and correlate this ANA positive and anti-Smith positive. This shows significantly any serological manifestations or clinical manifestations of SLE. So study AM, first of all, as we said, we conducted our study from 2000. We collect all patients who has truly diagnosed as SLE as per our ASR, which is American College of Rheumatology, from 2005 until 2022. And we estimate the prevalence during this period, but we conduct only the incidence in 2 years, which is 2021 and 2022. So we have two parts, the prevalence from 2005 to 2022, and incidence 2021 and 2022, 2005 to 2022. The other aim of our study, as we said, to see what are the clinical manifestations that our population in Abu Dhabi and Al Ain City both, that mostly have, as we know, we have hematological manifestations, renal manifestations, and neural manifestation and renal involvement. So we see what significantly that, how much percentage of each manifestation. And the last objective is to conduct what are the percentage of those patients who have anti-Smith positive, and we correlate if there is any correlation between the anti-Smith positivity with the correlate to any significant clinical manifestations. So our studies collected between multi-center, SKMC, SSMC, AHS, ambulatory health service, and Tuam Hospital in Al Ain. So as we said, it's a multi-central. Now moving on to the demographics, our total population was 292 participants, which is confirmed that diagnosed as per as ESR, American College of Rheumatology criteria, clinical manifestations. So this is the brief about what is the ULR ESR SCR clinical manifestation diagnostic criteria. So all our patients were ANA positive, first of all, and all our patients were having met 10 points or more as per diagnostic of the ESCR classification criteria. So our inclusion criteria, our all population was adults patient, 18 years old and above, and they all met our criteria. We exclude because we know when a connective tissue disease is suspected, also the ANA will become positive, And these patients may manifest as SLE, diagnosed as SLE patient wrongly. It's not SLE patients, maybe the other any connective tissue disease, so we exclude those patients. And we exclude any drug-induced lupus diagnosed patient, and the patients who have any cancer or especially hematological disease. So brief about our methodology. Our 95% of our population was female, as suspected as the SLE is autoimmune disease that mainly affects females. This is the box plot, which shows what are the mean age of our population. So our mean age is 39. Most of our patients come from 35 to 45 years of old, which is the age group that reflects most of autoimmune diseases. Most of our patients, 73% was UAE nationals. Those are the criteria. So all the ANA was all our population, 292 participants with ANA. And this shows that our population reflects that those patients are truly SLE patients. As we know, ANA is the most sensitive test that sensitive to diagnose the SLE patient. Regarding the anti-Smith antibody, only 67% were negative anti-Smith antibody, and only from out of them, 13% were anti-Smith positive. And the other patients have no previous records of anti-Smith antibodies. So those are the SLE manifestation. As we know, SLE can manifest as per MSK, musculoskeletal manifestation, hematological manifestation, neural manifestation, and renal manifestations. And we studied all of them and keep it a dot percentage. So what are our results? Now, as we said, the incidence, we only have the incidence, the crude incidence in 2021 and 2022. So the crude incidence.
Quickly, you can proceed.
Okay.
Can we give him slides?
So the crude incidence was 2021 was 1.8 per 100,000 and 1.2 in 2022. So these are the percentage of SLE manifestation. As if we focus on the hematological manifestations, that was the most common manifestation as per anemia and leukopenia, followed by MSK manifestation and renal manifestation. This is maybe the most important thing, that did we have any sufficient correlation between anti-Smith positivity and SLE manifestations? So first of all, anti-Smith positive antibodies showed that 80% of them, which are males that manifest for SLE manifestations, compared to 71% who those have anti-Smith negative. And in the blue, as we can see in the blue manifestations, which are the hematological manifestations, anemia, leukopenia, thrombocytopenia, SLE, anti-Smith positive positivity correlate by p-value significant to those with hematological. Yani if we have anti-Smith positive antibody, may indicate that this patient need a CBC follow-up more regularly as they are manifest with the manifestations of hematological manifestations. So what we can take home message from our study. So first of all, is like the SLE. We should educate the patient. Our population, SLE in our population, UAE especially, is very common. So it's not uncommon, as per what shows in our prevalence and incidence. And we need to follow up those patients, especially with those anti-Smith antibodies positive, because as per our study, is significantly by p-value correlate more with the SLE manifestation and with especially hematological manifestations. And we should initiate the treatment early as possible, as to reduce the progression of the disease and the severe complication of the disease itself. Thank you very much.